Move on and talk about Medicare, and how do you know if you qualify for it, and more importantly, how do you know how to choose the right one? We checked in with Dr. Tony Alamo with Optum Care for a full breakdown of how Medicare works.
Dr. Alamo, welcome back.
Well, thank you for having me here this afternoon.
Yeah, it's been a while. We haven't talked about Medicare in months here, so let's break down the basics for people. Who is eligible for Medicare?
Very good. Well, that's a great question. And there's several categories, so let me go through them real fast. If you're at least 65 years of age, gets you eligible for Medicare Advantage. If you're under 65 but have a qualifying disability, that too can make you eligible for Medicare Advantage. There's another criteria. You can be any age. If you suffer 2 disease states, for example, end-stage renal disease or ALS, that too can make you eligible. If you move from another area and now you live here in Southern Nevada, you can go ahead and jump on an MA plan. At the end of the day, though, if you're fee-for-service, Medicare 65 and older, with none of the things I've mentioned, well, there are enrollment periods.
And what are the best steps for choosing your Medicare plan? I know you mentioned Medicare, Medicare Advantage.
Everybody needs to look at their own situation. There's just not one plan for everybody. It's many plans for many people, right? So look at yourself and see, what doctors and specialists do I need? What medications do I take? What other services do I want? You know, you have to make sure that if you're seeing currently certain PCPs or certain specialists, make sure they're on the plan. If you're already taking certain medications, by all means, make sure they're covered. There's other things, too, that some patients may not realize that they need or want, you know, dental, vision, hearing, fitness memberships, transportation services. All those things, even though you may not be using them now, you may want them in the future. Look at the plans that offer those.
Exactly. I see you guys say personalize your choice, so that's really important.
There's a lot of plans out there. So look at each one. And look again, the networks may be similar, they may be different. What do I mean by networks? I mean, who are the doctors on? What services are there? Look at each one and make the fit for you. It's hard for someone to do this on their own. And that's why we have independent agents, and we also have a line, which I think you're going to socialize, where they can call and get advice, ask for help.
And what other resources do people have to get more information? There's
always your physician. Believe it or not, your doctor is a good source of information because he is participating on some of these plans. Ask him. Ask your doctor, what do you think would work for me? You can ask their staff. There's plenty of independent brokers out there that can definitely get you good informed information. And here at United Healthcare and, of course, Optum Services, we have phone lines just for this. But I always go back to the #1 source, ask your doctor.
Ask your doctor. You can also go to Medicare.gov, right? That's easy enough.
Absolutely. If you know how to operate a computer, which I've had to learn how to do.
Southwest Medical has several locations across Southern Nevada. Call them at 702-242-7119 to speak with an agent or visit smalv.com for more. In Las Vegas now, we